I don't think black and white, I think like in a rainbow.
I remember coming home one day and she said to me, "Mom, am I different than other kids?" I said, "Well, you have challenges that other kids don't face, but you face them every day and you do a great job." Elaine is on the autism spectrum. Obviously, she had more struggles to overcome than other kids. I think you're 2 when you go to your first dentist appointment. And Elaine's in the room seeing what she's doing and she's talking about what she's doing. So when it's her turn, she understands. And she said, "I'm not doing it. I'm not doing it." And I'm like, "Honey, you got to get your teeth cleaned."
I am the mom of a 20-year-old autistic son. He still does not like going to the dentist. It's a lot of sensory for him. He doesn't like the feeling of the teeth being messed with by somebody other than himself.
The other thing was getting a shot. We're at urgent care once. She comes out with a needle and Elaine hopped off the bed and ran out of the room.
When an autistic child is sick, physically or with pain in their mouth, it makes them unable to cope. Why wouldn't you keep illness from your child if you could? We would do a step-by-step exposure to the office. Bring your child in, just sit out in the waiting room with the child and read a book for 10 minutes and leave. Do that a couple times so the situation isn't overwhelming.
Preparing him the day before on the way to the dentist, in the waiting room, on our walk into the dentist exam room, the preparation benefited him in the sense that he was able to go through the next ones after that without much of a problem.
Sometimes it takes us 5 visits to get to doing something in the mouth, and that's okay. But those 5 visits, you're still working. You're doing things like building trust, building familiarity, repetitive tasking.
Vaccine hesitancy is a part of every day of a pediatrician's practice. Becoming knowledgeable about what that reason is so that you can meet the families where they are. I like to tell my children what to expect. Here's what the doctor is going to do. Here's what the exam is going to look like. And here's what I expect of you there. And make sure that the provider lets them know what's going to happen to them before it happens. So they're not surprised in getting a shot or being held down for their dental procedure, whatever it is, that they know why that's happening and how they can change it so next time it doesn't happen that way if it's not a pleasant experience.
I would definitely want to have an inviting environment, making sure that they have a provider that's calm. If they have any particular toys, things like that to bring with them, take as much time as possible to make the child or the young adult comfortable with the situation. And hopefully they'll be able to come back again and look forward to it.
You're not working on a tooth, you're working with a patient. And just communicating with that patient and saying what works for you, what does not work for you. What can we do to help? What should we avoid?
I laid in the chair. I said, "You lay on top of me." 2 years after that, every time I went to the dentist, Elaine would lay on top of me and I'd hold her. The comfort knowing that I was right there and that it wasn't going to hurt her or anything like that.
And once I learned that it was okay, like that it's just the dentist, and I just adapted to it basically.
With any child, whether it be an autistic child or a developmentally disabled child, you just want your child to do their best. We're not going to be here forever. You're going to have to learn to do this yourself. You've got to learn to advocate for yourself.
You want to help your child the best that you can, and the only way you're going to be able to do that is if you know what you're doing, and you can't know what you're doing if you don't educate yourself. The Autism Alliance of Michigan has been an excellent resource for information. Resources and education and routine are the biggest things that you can provide for your child when they're diagnosed with something like autism. Those resources, they're going to help you get further than anything will.